This is the Sunday Business Page with Jon Delano.
Good morning. Welcome to another edition of the Sunday Business Page. I'm Jon Delano, and our very special guest today is Ken DeFurio, who is president and CEO of really a new merged hospital system called Independence Health System. Ken, thank you, sir, very much for spending time with us. I really appreciate it.
Good morning, Jon. My pleasure to be here.
So, as I understand it, on January 1st, Excella Health and the Butler Health System merged together, and you have recently renamed yourself as the Independence Health System. Do I have that right?
You have that right, yes. Two very strong independent health systems, obviously Butler Health System to the north of Allegheny County and Excella to the east of Allegheny County. You know, some tough times hit, as everybody out there knows, Jon. The pandemic changed healthcare, I believe, in this country forever. And while both Excella Health and Butler Health System were doing quite well, like just about every health system I know across the country, times have changed, and they've changed significantly. So credit to the boards that were in place at both places over the last, couple of years. They got very serious about what does a sustainable future look like, and obviously the decision was made to come together.
Well, this makes this health system the third largest in our region. Is that right?
It does, yes.
Can you give us some idea of the number of employees and doctors and who you serve?
Yeah, it's pretty significant, actually. We have somewhere in the neighborhood of about 7,300 employees, approximately 1,000 providers, which is both physicians and advanced practice specialists, nurse practitioners and physician assistants. Probably give or take 700 of those are physicians and 300 of the advanced practice specialists. Serving a pretty large geography. I think one thing that makes us a little bit different is we're spread out here. If you look from, southern Westmoreland County and work your way up north, up into Venango County and Clarion County, where we have a presence, it's a large geography, and every now and then I have to drive that in a day, and I can tell you it's a trek. So we're covering a big geography, serving a population of about 750,000 people.
Wow, 750,000. But you don't reach into Allegheny County, do you?
Oh, not really. We have a service or two. We might have a physician's office or a clinic on the, just over the border on the other side of southern Butler County or western Westmoreland County, but not too much of a presence in Allegheny County.
As you know, Ken, with most mergers, we tend to think of it as really an effort to downsize employment. Are you laying off people? Do you expect to lay off more people as you merge services with these two health systems?
Yeah, Jon, the unfortunate reality is getting cost out of the system is one of the reasons you do this. We really are focused, and I mean this sincerely, on expanding clinical services and having the services people want and need close to home. But having said that, the pandemic changed everything, and I think everybody out there is aware that healthcare took a big hit. We went through a period where we actually had to cancel and not schedule any elective procedures. There certainly was a revenue implication to that. And then costs just started to go through the roof. Everybody heard about the cost of nurses and the cost of allied health professionals and supply chain issues and access to drugs and all of these different issues. Well, much of that has settled down, but the reality is the cost have increased and our reimbursement has not increased at all. We largely see payment from government payers, Medicare, Medicaid, and then in Western Pennsylvania, there's some smaller amount of commercial contracts, meaning health insurance that comes through employers. Those contracts are by nowhere close to enough to offset the low reimbursement that we get from government. So every health system in the country is working through this right now. Unfortunately, to answer your question, we had a few layoffs a couple months ago. In the management ranks. It would be disingenuous of me to say that that is over. I don't think it is. We have to, and I'm not big on consultant words, but a consultant word that I sometimes hear is right-size the organization. The reality is we are right-sizing the organization. We're taking a look at the the market that we serve, the population that we serve, and the resources that we need to have in place.
Right.
Frankly, it started at the top, which I am a strong believer in, where we can trim executive expenses and management expenses at the top of the organizations. That's where we have begun. And,
well, I think I mean, most people understand that that's the consequence. We've run out of time, Ken. So again, I want to congratulate you on the merger, on your new name, the Independence Health System, the third largest in southwestern Pennsylvania. Thank you, sir, very much for spending time with us. I do appreciate it.
Thank you, John. My pleasure. Really appreciate it.
And thank you for watching this edition of the Sunday Business Page. Have a great Sunday, everybody.